All right, now let me share. Are you still there, Perry?
Yeah.
Okay, it froze up on me. Okay, so if anyone has joined us, please go ahead and drop a comment. Let us know where you are watching us from. And I'm just getting this shared here quickly into a couple of groups. Okay. It looks like we are live. So welcome everyone to this month's TBI talk brought to you by Integrated Brain Centers. This month, I am here with Dr. Perry Maynard, and we're going to be talking about functional medicine and how it can integrate with your recovery of a brain injury. So Perry, maybe let's just start by defining like what is functional medicine? What does that mean?
Yeah, it's a great question. I think a great point because you actually was listening to Datis Karazian the other day at one of his most up-to-date things. And he was kind of talking about this concept because I think there is some misnomers, about what functional medicine is, and he was talking about this concept of what's called green medicine, where you have a condition and then there's a treatment off of that condition. So let's say it is peripheral artery disease, right? So the arteries in your body are not healthy. Green medicine, which I think sometimes people confuse as functional medicine, that a lot of alternative people do. They say, hey, these 5 supplements are really good for this condition or this treatment, versus what functional medicine is personalized healthcare. It's saying, okay, you have, let's say, cardiovascular disease. Well, let's understand all of the risk factors and all the pieces of your physiology that play a role into that. So what's your blood pressure? What is your blood sugar looking like? What do your lipids look like? What is your inflammation looking like, right? And we're tracking as much of your physiological function to understand how that is affecting whatever disease or condition you are coming in with. And then it's not necessarily giving a treatment for a said disease. It's trying to, if possible, fix the things that are generating that, right? So if someone has hypertension that is damaging their blood vessels, that is leading to worsening of cardiovascular disease, it's saying, well, how can we understand all of the physiological mechanisms that affect blood pressure? And how can we make interventions either naturally with diet, lifestyle, and supplements, or medications if need be? So I think a lot of people think of functional medicine and are like, ooh, medication's bad. I don't think that should be the thought. I think it should be functional medicine is personalized medicine. It is medicine off of your physiology and your biology. And it's making interventions, kind of like when people say, well, what supplements should I take? And especially with concussions, which we'll talk about, I think there's a few supplements that have some really good research behind them that I think are kind of good for all people with concussions. But then a lot of times it's saying, well, what needs to be personalized for you? Because maybe someone has a head injury and they're diabetic, or someone has a head injury and they have hypothyroid, or someone has a head injury and they have dysregulated menstrual cycle. We may then use certain interventions to fix those physiological things so that those can have a positive influence on the concussion. So I wouldn't tell everyone, well, go take thyroid support for brain injuries,
right?
Or go take estrogen or testosterone per se. Is, do you need that? And is that going to play a role in your recovery? So that's really what functional medicine is. It is personalized medicine off of your physiology and your biology, versus just treating a condition where, once again, there's green medicine, then there's what traditional medicine does, which is says kind of similar, here's a condition. What treatment seems to work for the majority of people? So once again, going back to cardiovascular disease, an example, blood pressure medication, statins, are used in a majority of people, but I think people deserve more, and more can be done because not everyone with cardiovascular disease is created equally. One person might have gotten there from hypertension, one from diabetes, one from dyslipidemia or issues with cholesterol, one from chronic stress. So you can see where you may need a personalized intervention, and that is where functional medicine comes into play.
Yeah. And I think, in the traditional healthcare system, unfortunately, the systems don't all talk to each other. Mm-hmm. So you might go to your general practitioner, and for your brain injury, I'm saying you might go to your general practitioner and they discover, oh, you have high blood pressure. Let's send you to the cardiologist. Well, you came there for a brain injury, right? Mm-hmm. And now you're going to the cardiologist, and the cardiologist is like, oh yeah, you have high blood pressure. Here, take whatever meds they give you for blood pressure. But nobody's addressing the concussion. And it might actually be the concussion causing the high blood pressure. Like, the blood pressure might not be the root problem. Yeah. And I think that's the biggest problem I see in our traditional healthcare system, is that nobody talks to everybody and nobody looks for the root. They just look at the surface level. They look at the top of the iceberg. They're not looking down here. And I think that's where functional medicine and functional neurology in particular, that's where I think you guys really shine, because you're looking for that root problem. What is the root?
Yeah. And I think that's a really important part. And I think as we talk about functional medicine and functional neurology together, is that it's a balance between the two. I think functional medicine has its pros and its cons, but like you just mentioned, sometimes you get a functional medicine practitioner and everything is metabolic. So I have high blood pressure after a concussion, and maybe they're just thinking of dietary strategies, exercise strategies, but they're not paying attention to how the brain injury could be causing that. Or there is some interesting things or discussion, and actually, Dr. Kaiser and I were talking about this a few weeks ago, some interesting research talking about how actually low blood flow to the brain can sometimes create systemic hypertension. So when you look at blood pressure in the body and blood pressure in the brain, they're kind of distinct, different things, and they should be separate, right? Because if there's hypertension in the body, I want to protect my brain from that blood flow wrecking it, and vice versa. And so it was discussing some of this concept of where seeing increased risk of Alzheimer's disease on individuals on blood pressure medication, right? So this treating of a symptom that could be secondary to a blood flow issue in the brain. So then you lower blood pressure even more, and then you possibly lower blood flow to the brain even more. Right now, it's important to realize that hypertension is not good, and hypertension can destroy the brain. But it just goes back to understanding the neurology, but then also understanding the metabolic side. I think there's a lot of people on the functional neurology realm where they have a pretty good grasp of the neurology, but they're not paying attention how low iron or a thyroid issue or dysfunction in one's menstrual cycle may be affecting their brain injury recovery, and vice versa. People on the functional medicine end aren't giving enough credit to the neurology. So there has to be that balance, right? And there should be this interplay, because when we're looking at concussions, really only a few things happen. And what I mean by that is that there is structural damage. And what I mean by that there's shearing of axons. So connections become disrupted. And that's where I think functional neurology really shines in rewiring connections. But we can't forget that a brain injury affects the metabolism of the brain. So neurons become hyperexcitable, but then they also decrease their ability to utilize glucose. So then they become actually hypometabolism. There becomes a hypometabolism state in the brain. This is where dietary strategies like ketogenic diets can play a role, right? And then there's inflammation and shifts in the immune system. So this is where the functional medicine side comes in of how diet, supplements, medications, things like past infections, thyroid issues, all these other things can influence, because if I already have diabetes or cardiovascular disease and I already have inflammation and then I hit my noggin, my brain is already ready to set fire.
Mm.
And if I don't address that, I don't know if rehab alone, it may help that person. And it may, depending on what they have going on, but we really have to take the individual, take their symptoms, take their findings, and determine how much of it's metabolic and how much of it is more neurology. You know, Dr. Stedman and I talk about that all the time. It's kind of like, how much of this seems more metabolic? How much of this seems more brain? Because that's going to determine what's done that might help. Because,
Right.
you know, you may give someone a supplement and that's what they need, or someone may need something like vestibular rehab. But you have to be skilled in both arenas to understand when to use either one.
Mm-hmm. And, you know, like you're saying, it could be both structural or metabolic or both.
Usually it's both.
Yeah. And I don't feel like the traditional system addresses metabolic like at all. You know, like if you find a really good doctor, they might tell you to like take fish oil or something, but that's about all you're going to get in that realm. And I think, you know, that's where I got so frustrated, is my symptoms just kept getting downplayed. You know, like I had dizziness and vision issues and headaches, and, you know, they would only they focused a lot on the headaches and my neck pain because they wanted to give me Botox injections. And I was like, but that's not going to fix what's going on here. You know, and I just knew that there was so much more going on within me that nobody would talk about until I found functional neurology, and then it all like clicked together. And I just think it's such a missing link. And I think, you know, I see people struggle and struggle and struggle for years after a concussion. And it's like stuff that should have been addressed, right? Like your metabolic stuff. And it's just getting missed. And it's so incredibly frustrating for so many people.
Yeah, I mean, it's crazy the amount of doctors that you still chat with that believe that diet and some of these things just have zero influence on any of these things. So I would say the metabolic side is definitely missed. And then the connection of why some people maybe have worse outcomes.
Yeah.
You know, I think we're starting to recognize it, right, with COVID, that we're starting to see, like, although it can affect anyone, that individuals with comorbidities, right, things like cardiovascular disease, diabetes, hypertension, definitely have a worse outcome. So we're finally recognizing, like, yeah, hey, these pre-existing conditions can make not such a great outcome from this other illness. Well, brain injuries are exactly the same way. You know, so I think it's changing. But the other piece too is that if we're looking at the traditional model, it's very much dictated by insurance. And for insurance to cover that, they don't recognize it. They don't fully see the connection, or the research is definitely there, but until it's put into a randomized controlled trial with a certain patient population, it's not going to get recognized. You know, so as long as that's the case, general healthcare providers won't go down that arena because they're not going to get reimbursed for it. They're not going to get approved by the insurance company to discuss it because it's not the standard of care. But I would agree, they're missing a lot.
And I mean, that's a whole other bird, right? Talking about the healthcare and health insurance. And I think that's the trap that so many people fall into is, you know, if it's not covered by insurance, they're not going to seek it out. And, you know, that, like I said, that's a whole other conversation. So tell us some of the things that you might consider with a patient that comes in, with a brain injury. What are some of the things you might consider doing in the functional medicine realm?
Definitely. So from like a basic overview screening, of course, it's always important to look at basic blood work. So these are things like red blood cells, white blood cells, liver function, kidney function, all the generic things that most of the time people come in with that their GP ran. But I think looking at blood sugar markers, so these are things like fasting glucose, A1C, things like fasting insulin, which allow you to look at your insulin sensitivity. A few other markers, one called glycomark that looks at more dynamic fluctuations in blood sugar. Sometimes I'll also use what are called continuous blood glucose monitors, so I can track one's glucose 24/7. I think it's really important to look at thyroid health, because here's the thing. The question is, was there a pre-existing thyroid issue? And that is part of the reason of why they're sluggish in recovering, or part of the reason why there is a lack of endurance in the brain. Or did the brain injury create a thyroid issue?
Right.
And now is perpetuating it. I mean, I have
chicken or egg.
Exactly. And I have and there's certain patterns that can sometimes give you a window into that. But I have a younger patient, he's 18, I think, and his whole neuroendocrine axis is off. So his ability to produce cortisol, testosterone, thyroid hormone. And if you look at all the signaling molecules from the brain, they're all squashed. So his brain injury affected the part of his brain that signals to the body to produce hormones. And so that's where you can see the brain injury caused a neuroendocrine issue. That neuroendocrine issue is now going to affect his recovery. So I always like looking at things like sex hormones. So in females and males, looking at testosterone, estrogen, FSH, LH, all those things that come into play with that. Looking at inflammation is really, really important. So things like CRP, homocysteine, glyca A, those are really important to look at. Is there inflammation going on? And then looking at like things that have to do with like vascular health. So really looking at lipids, inflammation within arteries, because anything that compromises blood flow to the brain is going to hinder recovery. And then from there, it might get a little bit more specialized off of their condition. So let's say we have someone who is having blood pressure issues. So maybe their inability to maintain blood pressure. That could be brain, but now I might start looking at markers that come from the kidneys and the adrenal glands that also play a role in maintaining blood pressure. Maybe I'm looking at things like epinephrine and adrenaline in those levels, right? So I have some kind of blanket things, but then depending on what I find exam-wise in their symptoms, we may go down some more specific rabbit holes, maybe looking at adrenal function, vascular function. But I think the big things are looking at hormones, so thyroid, sex hormones, looking at blood sugar, insulin, and then looking at inflammation. And then off of that, and then the immune system, then off of that, you can decide, do you need to break down or go deeper in any of those rabbit holes, right? Do you need to look for chronic viral infections? Yes or no? Do you need to be more concerned about blood sugar dysregulation? Do you need to be concerned about cardiovascular disease risk and how that might be impacting? Do you have to be concerned about neuroendocrine function? So their thyroid's off, their testosterone's off. So that's kind of where I like to start, and then we can go deeper if we need to.
Mm. And so what are some, we mentioned at the beginning that there are some supplements that you do recommend for anyone after a brain injury. And so what are some of those supplements, and, what are they good for? How do they help?
Yeah. So you mentioned one earlier. I think fish oils can have a massive influence. So when you're looking at fish oils, you have EPA and DHA. DHA is a little bit more associated with brain function, but EPA has a ton of the research on it for monitoring and managing inflammation. EPA is also studied a little bit more in cardiovascular disease and cardiovascular inflammation, but this is where you can look at sometimes, individuals taking anywhere between like 3 to 5 grams. So pretty high dosage. The research on inflammation for things like depression is around like 2 grams, I think, where 2 grams of EPA daily showed improvements in depression scores and brain inflammation. So EPA, but also a very high DHA is something that I think is, for the most part, is going to be beneficial for anyone. Another thing too is like we talked about. So we know that early on in a brain injury, the brain becomes hyper excitable. So these sodium potassium pumps become kind of unstable. So this is where things like magnesium glycinate or magnesium threonate is helpful, because what that does is help and come to chill out that hyperexcitability. So certain types of magnesium can be helpful in managing that hyperexcitable state of the brain early on, so you keep it from burning itself out. Other things that I really like early on also too, is this is where I really like things like exogenous ketones. So this is either ketone esters or ketone salts. So these are giving the molecule that you would get if you were fasting. So when you burn fat for fuel, you get ketone bodies. And the reason I like ketone bodies is that after a head injury, your brain struggles making energy off of glucose, so that your brain starts to starve. And this causes more neurons to die. So by giving ketones or going into something like a ketogenic diet, you help to stabilize energy. So what I'm trying to do with the brain is to think about, okay, how do I slow inflammation? How do I decrease hyperexcitability? And how do I keep a steady stream of energy going on? Okay. There's some other interesting research. This is where you can look at even things like curcuminoids. So different forms of like turmeric, resveratrol. There's some interesting things looking at different like CBDs and CBN. So those can also have some anti-inflammatory standpoints. Glutathione is another one that I really, really like from early on, trying to manage that inflammation. Sometimes we'll do it orally, or we'll do it intravenous in a vein. And one other thing too, that can sometimes be helpful is what is called NAD. This is not one that I recommend for everyone, but if a person is a right candidate, this can help to restore energy systems in the brain. But when we're thinking about supplements early on in a brain injury, we want to think about manage inflammation. That's where the fish oil comes into play. Manage hyperexcitability. This is where magnesium, specifically threonate and glycinate, come into play. And then stabilizing fuel, ketogenic diet, ketones, or just doing things to stabilize blood sugar, right? Those are 3 simple ways that are pretty safe, and the research shows that are effective to combat all the different things that may occur with a brain injury.
And so anyone that's watching, and by the way, if anyone does have any questions on anything we've been talking about, go ahead and drop those in the comments. But if anyone wants to learn more, they can visit integratedbraincenters.com, and you can schedule a 30-minute consultation with Dr. Maynard or Dr. Stedman. And you guys are located in Denver, Colorado.
Yep.
And so if anyone is not in Denver, but they're still interested in working with you, you guys also offer like a week-long intensive. So tell us a little bit about what that would entail.
Definitely. So for a lot of our patients that come from out of state and some in-state, we will do intensives anywhere between 1 to 2. I mean, I've done month-long intensives with patients. That's not super common. But what's really cool about intensives is that you come on in, we work you up, but then you're with us all day, every day, right? From kind of sun up to sundown, which kind of sounds exhausting, but it allows us to really understand the case, really figure out what's going on and what we need to do. And then once we find therapies that seem to be helpful, we can work on them all day long. So when we're looking at the brain makes connections off of kind of intensity and frequency. So the brain doesn't really make changes when you do something once in a while, right? Once a week, few times a week. You need to do things consistently. You need to fire pathways over and over again to try to create plasticity or connection. So neuroplasticity is kind of a big buzz term right now.
Right.
Research shows to actually create neuroplasticity, sometimes you need upwards of multiple hours a day, every day, for up to 12 weeks to actually make a permanent connection. So intensives work really well because you're really firing the brain at an appropriate rate to make changes that actually last. Versus, when you talk to people like, oh yeah, I see someone like once every 2 weeks, and it's like, that's not enough to make a change, not neurologically. So it really allows us to figure out a case and then be able to really have one-on-one time with the patient and the doctor for anywhere from a week to multiple weeks, where we're working every day. And then we can do things like hyperbaric. We can talk about diet. You can meet with all of our practitioners. It's just a way to really get a full team approach for a patient.
Yeah. Yeah, wonderful. So again, if anyone has any questions, they can reach out at integratedbraincenters.com. And thank you, Dr. Maynard, for being here. It's always a pleasure chatting with you. And I hope that you watching, that you gain some valuable knowledge today. And again, reach out to Dr. Maynard if you have any questions. If you're watching the replay, go ahead, drop a comment. We'll try and get to your questions and get you an answer. And we'll see you all again next month. Thank you, Dr. Perry.
Thank you so much, Amy.